Do you want to know specifically what workplaces are having COVID-19 outbreaks? It turns out this information is kind of hard to come by. It's not really being disclosed by public health. So, a Toronto Star article did an investigation about it, and they actually found that by analyzing the workers' compensation claims, they did find that specific industries are getting hit far harder than others, specifically nursing homes, farms, hospitals, food manufacturing facilities, and the like. The question is, do you want this information to be more transparent to us, the public?
I certainly would. I mean, these maps that they have, at least in Toronto, are great. They tell me that my neighborhood is basically blue and relatively safe, but that 2 kilometers away, sort of around the perimeter, there are hotspots everywhere. And I want to know, is that because of the high-rise apartment buildings? Is it because of the condos, places of worship, or little restaurants? I'd like to know, because then I could actively avoid certain places, or conversely, not worry, or worry less perhaps, about visiting, let's say, the small restaurants. Some of these restaurants have invested thousands of dollars to turn their little, 30-seat eatery into like a 10-seat place where everyone can safely distance themselves. And it's just enough for these restaurants, just enough business to keep them afloat, or to maybe even break even. Are these places hotspots? I don't think so, but I would like to know. I'd like to see the data so that I can make more informed decisions.
That's a great point, Jess. And maybe information is what the government needs for itself to actually make some more meaningful change. I think if you can't name something or you can't face it, then you can't change it. And what strikes me from this preliminary information is these are not just numbers. It's not just industries. It's the people who these numbers represent, because these, by and large, in these industries, whether you're talking about long-term care facilities, farms, home care, it's largely women that we're talking about. We know that this pandemic has disproportionately hit vulnerable communities. And so it's women, it's low income, low salary wage earners, it's immigrants, it's migrant workers. And I think that if there is any hesitancy in naming these industries, it's because you cannot turn off once you turn on the knowledge that these are people who are already struggling and at the fringes, who are disproportionately also getting hit with the virus, because that requires a big pull from governments. We're only judged by how well we take care of the most vulnerable people in our society. And if the lowest income earners, for example, in a long-term care facility, aren't getting what they need and are therefore getting the virus and spreading it to their communities, that's a problem. And it's a problem that the government is uniquely positioned to fix. So you got to name it to change it.
Yeah, I want to know more information. Like, I understand the hesitancy around it, because I think if we heard, that there were outbreaks in certain types of arenas, we might be less willing to go there, and that can impact business. But the reverse is true as well. Like, I heard this one story a little while ago that there was a hair salon, for example, somewhere in Ontario, I believe, where the hairstylist had COVID, and because she was wearing PPE and the customer was wearing PPE, it wasn't communicated. No one else in the entire salon got it. Those are the stories you want to hear more of, because then that makes me realize, oh, okay, maybe it is safe for me to go out, because I've basically been stopped. I'm stalled out in phase 2. I'm not leaving the house for hardly anything. And that's not good for the economy either. I want more information. If I find out, for example, that banquet halls have been having outbreaks, oh, great. I don't go to banquet halls. I'm not going to a wedding. I'm not going to any event. I'm not doing it. But I might then venture out and decide to support my local restaurant. Right. So I think they really do need to really rethink what kind of information they're giving out so we can make better decisions.
Well, here's the thing, Sin. They're not putting out that information because that means that they would have to openly admit that they are just not prepared to fix anything or to really spend their time and attention in these spaces. And that's just the way that I feel about it. Listen, I've had group chats. I have group chats going on. I have phone calls that have been made. If anybody hears anything about any place that has a coronavirus outbreak, because we are all looking out for each other. But that should not just be in a private level. That should be a public thing as well. We need to be incredibly important. It's incredibly important that we remain transparent, especially about these industries, so that we can self-police. Because guess what? A lot of us have had to self-police ourselves. We just headed into a long weekend where there was no restrictions. So the restrictions we had to put on all of ourselves, because Dougie Fresh would not not say so was just because you can does not mean you should. And so what we need from our government is more transparency, because if they're not going to put down the restrictions and lay down the law, we have to, as parents, as family, as people in our communities, we need to make decisions on our own.